Welcome to our channel. Today, we're diving into a genetic condition known as Alport syndrome. This rare disorder affects the kidneys, ears, and eyes, and is primarily characterized by its progressive renal failure, hearing loss, and ocular abnormalities. Alport syndrome is caused by mutations in the genes that code for collagen, specifically type 4 collagen, which is a crucial component of the basement membranes in various organs. The most common forms of Alport syndrome result from mutations in 3 genes: COL4A3, COL4A4, and COL4A5. These genes are crucial for the structural integrity of basement membranes in the kidneys, inner ear, and eyes. Alport syndrome can be inherited in several ways. The most common inheritance pattern is X-linked, meaning the responsible gene is located on the X chromosome. This form predominantly affects males, who have only one X chromosome. Females can also be affected, but they often have milder symptoms because they have a second X chromosome that can compensate for the faulty gene. There are also autosomal recessive and autosomal dominant forms of the syndrome, though these are far less common. The symptoms of Alport syndrome typically manifest in 3 areas: kidney function, hearing, and vision. Kidney-related symptoms usually begin to show in childhood or adolescence. Patients may experience hematuria, which is the presence of blood in the urine, and proteinuria, or protein in the urine. Over time, these symptoms may progress to chronic kidney disease and ultimately lead to end-stage renal disease in late adolescence or early adulthood. Hearing loss is another hallmark of Alport syndrome. This often develops in late childhood to early adulthood, resulting from damage to the inner ear structures. The hearing loss can be progressive, leading to difficulties in understanding speech and effectively interacting with the environment. Visual problems related to Alport syndrome can include lens abnormalities, such as anterior lenticonus, and retinal issues. Anterior lenticonus is characterized by a cone-shaped deformation of the lens of the eye, which can affect vision significantly. Diagnosis of Alport syndrome begins with a thorough medical history and a physical examination. If symptoms are present, a urinalysis may be performed to detect hematuria or proteinuria. Genetic testing is often used to confirm the diagnosis by identifying mutations in the collagen genes. A kidney biopsy can also be performed, showing characteristic changes in the kidney's architecture that are consistent with Alport syndrome. Management of Alport syndrome focuses primarily on monitoring kidney function and addressing the symptoms as they arise. Patients are generally monitored regularly with blood tests and urine tests to assess how well their kidneys are functioning. When chronic kidney disease progresses to a significant degree, patients may require treatments such as dialysis or a kidney transplant. Hearing aids or cochlear implants may be recommended to manage hearing loss, improving the quality of life for those affected. Regular eye examinations are important to detect any potential issues early, allowing for timely interventions when necessary. Research into Alport syndrome is ongoing, with studies exploring gene therapy and new treatment modalities aimed at slowing the progression of kidney disease. These advancements hold hope for improved outcomes for patients living with this condition. In summary, Alport syndrome is a genetically inherited condition that primarily impacts the kidneys, ears, and eyes. Early detection through genetic testing and symptom management can significantly improve patient outcomes. If you or someone you know is experiencing symptoms associated with Alport syndrome, it's essential to consult a healthcare professional for further evaluation and guidance. Thank you for joining us today to learn about Alport syndrome. If you found this information helpful, please like, share, and subscribe to our channel for more educational content on various medical topics. Your health matters, and understanding conditions like Alport syndrome is a step toward better awareness and care.